Most of our family members are treated for free for life here at our nonprofit clinic. The second population we see are veterans, fellow combat veterans. I see a lot of Marines, a lot of soldiers, airmen and sailors, and we get them taken care of at cost. And then the third population that we see primarily is postpartum depression and peripartum depression. Those are moms who are struggling in that phase. And this is a very advantageous treatment for them because it's non-pharmacological. If you're breastfeeding, we don't want to put sertraline or fluoxetine in the breast milk as step one. We want to do a non-pharmaceutical intervention that has no pass-through effects to the baby. So that's one of the primary advantages of TMS in postpartum, is that it cannot affect the child. And then our last population is pretty much everyone else, where TMS is FDA cleared to treat depression, anxiety, OCD, and it's used off-label for PTSD and a variety of other conditions.
So Doc, you're telling me with magnets, you can treat all those symptoms that you just mentioned?
That's right. And if you should be skeptical of that, and what you would want to do is go to pubmed.org and look at the peer-reviewed scientific literature. There you'll see articles in the Journal of the American Medical Association, the American Journal of Psychiatry, and you'll find that I'm an author on a good number of those papers. So if you want it provided by not just someone who's familiar with the technology, but someone who's an author of the technology, this is where you want to go.
So help me understand, how long has this technology been around?
So it was FDA approved in 2008, but it's really come into its own in the last 10 years. That's been a lot of the recent FDA clearances, like anxiety with depression and OCD, have been approved by the FDA. And it's become more and more popular as people see the results that are able to be achieved with it, especially without pharmaceutical intervention. That's been, especially for our veterans, that's been a primary concern. Is I'm done taking pills. I just want to try something that has a physiological, mechanical application to a mechanical problem.
So you're telling me this is safe, is what I'm understanding?
Yep, it's FDA approved in pregnant women and adolescents down to 15 years old. So if you're approved in those two populations, that's as safe as it gets.
Are there any side effects whatsoever?
There are. The most common side effect is headache, which typically resolves in about 5 minutes. And you can take, Tylenol, ibuprofen, whatever works for you beforehand, and it's really not that big a concern. And there's a vanishingly small, like 1 in 30,000 chance of seizure, but again, the best way to look into that is pubmed.org and look at the safety and efficacy studies and see what those rates are. In 15 years of doing this, I have never seen a seizure.
Doc, so your practice is located here in Southlake, Texas.